Good morning, everyone. Good afternoon, depending on where you are. We're so happy you have joined the 2025 ACS Data Users Conference, and specifically the breakout session on childcare and school enrollment. I'm Melanie Poulter. I'm the Director of Research and Data for the Tulsa Area United Way. Joining us today to present, we have Ellie Nicolopoulos. Ellie is a research analyst with the Urban Institute. She will be presenting on using the ACS and public data sources to map public benefits access and barriers in Georgia. Then we will have Remsha Khan, who is a senior research specialist with data systems for the Citizens Committee for Children of New York. She will be presenting modeling the unaffordability of childcare and out-of-school care in New York City. We will then have Jill Walsh, who is Senior GIS and Data Analyst with CT Data Collaborative. Jill will be presenting on using the ACS PUMS to explore the affordability of market rate childcare for Connecticut families. And finally, we will have Leah Clark, economist with the U.S. Census Bureau. Leah will present a pandemic era public school disenrollment across the income distribution. So before we jump into those presentations, just wanted to let you know that closed captioning is available. To submit questions, please use the Q&A tab, not the chat, and we will address questions at the end of all presentations. Recordings and presentation materials will be shared after the conference. So let's kick it off and welcome Ellie Nicolopoulos.
Thanks so much. So give me just 1 second to pull up our slides. Hi, everyone. I'm so excited to be here or presenting on how our research team at the Urban Institute has used the ACS and other public data sources to map potential eligibility for childcare subsidies, public benefits access, and access barriers in Georgia, and why you might want to do something similar in your community, and extending broadly to the topic of childcare and school enrollment as well. And I'd like to start by thanking our funders, the Georgia Department of Early Care and Learning, for partnering with us on this research. So the reason why we undertook this analysis is that we're conducting a multi-year mixed method study to capture families' experiences with Georgia's childcare subsidy program. And we wanted to understand more about these families that we're trying to reach, understand where they live in the state, so we can target our survey outreach to places where we know that families are located who are going to qualify for our study. And we also wanted to know if certain families might be harder for us to reach, or they might face certain barriers to accessing childcare subsidies that we want to capture in our study. And as we were doing this, we realized that our findings could have broader implications for how our Georgia Child Care Subsidy Agency could reach families in their own outreach efforts, and that we could extend beyond Georgia in the childcare context, because the approach we took is one that is pretty simple to use, and it's based on public, easy to access data sources that don't require a data user agreement. They're openly available. So it's one that a lot of other agencies could adopt for themselves. And we also think it's a really useful approach that will tell agencies where the people they're trying to serve are located and what challenges they might face, so that agencies can design their systems to maximize efficiency. So today I'm going to be walking you through some examples to explain the takeaways from our approach. And we also have some published reports where we have more examples if you're interested in learning about those, as well as a step-by-step walkthrough of our analysis and links to public data sources if you are interested in doing something similar in your community. So to start, let's do a quick background on childcare subsidies. Subsidies help families pay for childcare and are really key for increasing access to childcare, given how expensive care can be for many families. The way it works is that the federal government provides funding to states, territories, and tribes, who often contribute additional funds, and then the subsidy will go to a childcare provider on behalf of a family that is deemed eligible for the childcare subsidy. And the way we determine eligibility is that the federal government has certain eligibility requirements that you can see here. And then states have their own requirements that they can establish within the federal guidance as well. So in Georgia, that means that families have to be state residents, they have to be employed or enrolled in an educational institution, and they have to be below a certain income threshold. And then one thing that is a little bit more unique about Georgia's childcare subsidy program is that families also have to be part of a defined priority population. So we have some examples here. There's also families who are survivors of domestic violence or natural disasters, and foster care families as some additional examples. But it's an additional eligibility beyond just residency, income, and work requirements that is kind of unique for the state of Georgia. And for this presentation, I'm going to be focusing on those priority populations. So I won't be talking about the other eligibility requirements, and we won't be modeling eligibility on a family basis. It's really looking at what families are members of each of these priority populations with a few key examples. So our research questions focused on understanding where our priority populations are in the state and if there are certain areas in which they're more concentrated or prevalent, as well as areas where we see multiple priority populations. As I mentioned earlier, we were also interested in understanding if families were going to face certain barriers to accessing the subsidy or maybe applying for the subsidy. And we identified 3 possible barriers, which are limited internet access, limited English proficiency, and limited access to transportation. So we wanted to look at how those access challenges were also distributed throughout the state. And then we wanted to combine that information to really understand if the people we're trying to target and the people who might be eligible for childcare subsidies are located in the same areas of the state where we see a lot of these access barriers. So getting into the data and methodology that we used, our first consideration was how we were going to select our data sources. So one of the main goals of our analysis was that we wanted to explore variation within the state. And in order to do so, we had to select a geographic level that was below the state level. Because if you look at the state level data, you're going to see uniformity, but we wanted to see variation. So in order to select that geographic level, we wanted something that would be contextually meaningful for how families experience the world. So we didn't want something that would be super small because some people don't identify with things like a zip code. And we also needed to make sure that data were available at that geographic level. And so with all of those considerations, we opted to use county level data. As an added bonus, they're very accessible in public data sources, again, not requiring data use agreements. So they're fairly easy to access. We used a variety of different public data sources, which included ACS 5-year summary level estimates, as well as data that are reported from the federal or state governments, either in formal reports or dashboards. And we selected 2019 data because we wanted to avoid pandemic-related disruptions. We were really interested in modeling how eligibility would look after the pandemic. And we know that a lot of states expanded eligibility for programs during the pandemic because of extra funding. So 2019 data were really the last available data at the time we were doing our analysis that wouldn't really capture the pandemic expansions. Now that we have our data, our next consideration was how we would represent our populations. So we came up with 2 options. The first is just counts, which tell us how many people belong to a certain priority group within a county. And the second is prevalence, which is the number of people in that priority group as a share of the county population. So you can think of that like a population proportion. Again, we wanted to be able to look across counties to see variation. And we wanted to do that in a standardized way. So we thought that prevalence or those population proportions would be a little bit easier to see where there is a disproportionate amount of those priority populations relative to each county's population. And it also meant we wouldn't overstate, say, larger urban areas, which have a larger overall population. So we would expect a larger count of those priority groups. By using a population proportion, we would be accounting for the fact that urban areas are larger, and so we wouldn't be overstating them in our analysis. What this looks like in practice is this formula. So again, it's the number of people in the group over the total number of people in the county. For our data sources, we focused on state or federal data reports for that numerator. And then our denominator, we used ACS estimates for that county population that most closely relates to the priority population. And I'll get at what that means with an example in a little bit. I will note that for some populations, the ACS already produces estimates of proportions that we used, so we didn't calculate our own for those. And then using all of the prevalence calculations we had, we created maps to show individual distribution of prevalence as well as the overlap of populations. And those are what I'll be showing in our findings section. So as an example, we looked at families of children with disabilities we defined as students who were served by the Individuals with Disabilities in Education Act, Part B services. That service is available for children ages 3 to 21. So we wanted to make sure our denominator, our total county population, was representative of that age group, the 3 to 21. And the closest way we could get there was using an estimate of the county population under 21. So the reason for this is because we wanted our percentages to actually be meaningful to that priority population. And if you use the population of the entire county, you might be misrepresenting counties that have a very large proportion of older people or a small proportion of younger children. So adjusting the denominator to suit the numerator is going to give you more meaningful comparisons across counties. And when we map it, we can see that distribution of the prevalence throughout the state. So this gradient goes from 0 to 12%, 12% being the highest proportion in the state. And we can see the distribution and the variation between counties. And I think the maps really help us isolate this distribution and variation. When you're looking at an Excel with a bunch of proportions, it can be hard to see what the min and the max is and what that means in context. And looking at the map, we can really see where there are areas with higher and lower prevalence and what the proportions actually mean in the context of the state. So to get into some of our examples, we are going to start with our priority populations, and we're going to look at our families with very low incomes. These are families who have incomes below 50% of the federal poverty level. So this map is set up very similarly to the last one, but you'll notice that there's a much more even shade of blue throughout, other than the one county in the south that's very, very dark, which means it has a very high prevalence of families with very low incomes. But throughout the rest of the state, it's a little bit more evenly distributed. Yes, we see some higher prevalence in the southern portion of the state outside the Atlanta metro area, but it's still relatively even. And so what that means for us is that if we're trying to reach this population, either through our survey or in advising our partner agency, we might consider a little bit of a stronger outreach outside of the Atlanta metro area to make sure we're getting those areas where we expect a higher prevalence of this population. But a statewide approach is probably going to work for us because we see some level of uniformity. In contrast, when we look at families experiencing homelessness, we see that throughout the state, a lot of states are in that very, very light blue section, which means we don't expect a high prevalence of them. And there's a few counties that are very, very dark. And so there's a lot more contrast and variation throughout the state than in the previous map. So obviously this can tell us where we want to go if we're trying to look for families experiencing homelessness. But I think the main takeaway here is really contrasting with the previous maps, because we think of these populations as both being eligible for childcare subsidy in our definition, right? But they're not in the same areas of the state. And so that really challenges our assumption that we can reach everyone in our study or in our outreach for our partner agency by targeting the same geographic locations. It really challenges agencies to consider how different populations may be unique in where they're located and what they need in terms of targeted service delivery throughout the state. So just because you are eligible for childcare subsidy does not mean that you are behaving the same way as someone else who is eligible. So we had lots of priority populations over 10, and we wanted to be able to look across all of them and not just have to put all of the maps side by side. And the way we did this is to look at counties with a higher than average prevalence of multiple populations. So the way we did this is for each county and each population, we identified if they were higher than average based on a Z-score of 1. That meant that the county had a prevalence that was 1 standard deviation above the mean for that population. After we did all of those calculations, we tallied up the number of populations that were higher than average for each county, and that's what you see on this map. So 0 to 5 represents the number of priority populations for that county that was 1 standard deviation above the mean. And so the takeaway here is as we're looking to maximize our resources and reach areas where we want to find multiple different groups of people, we want to target those darker blue counties because we can be more sure that we're going to find a higher proportion of multiple priority groups. Next, we moved on to access barriers, where we tried to understand if there were characteristics for the populations that would make it harder for them to access information about or apply for childcare subsidies. So for this example, we focused on families without internet access who might not be able to Google information about the childcare subsidy or submit the online application for the childcare subsidy, to maybe explain why we might not expect to see as many applications from them. And we see that these families are more prevalent in rural counties. So our agency might consider some kind of non-electronic outreach if they're trying to increase access in those counties for a more equitable access approach. Beyond understanding the individual challenges that families face, we also wanted to know if the characteristics associated with those challenges were located in the same areas as the families who might be eligible for subsidies. So this can really show why, if we expect an area to have higher eligibility for a subsidy by that priority group, we might not be seeing as many applications or enrollments because of the challenge. So we can look at both maps together to figure out why that's happening. Although I will say the nature of our data means that we can only draw this conclusion at the county level. So we're not saying that individual families who are in a priority population don't have internet access, but rather that the county has both high levels of one population and high levels of lacking internet access. And we can look at this side by side, but it's a little hard to draw direct comparisons. And so we came up with this new mapping approach where we characterized each county based on whether the prevalence of families with very low incomes was low or high, and whether the prevalence of families without internet access was low or high. And then we combine this information in the matrix you see here. That low versus high determination was based on where the county was relative to the median for the state on each measure. And in the dark blue, we see the counties that have both a higher prevalence of families with low incomes and families without internet access. And so to reach these families who we think might be eligible for subsidies, we might consider some kind of non-electronic communication that's concentrated in the darker blue areas of the state. So to sum up, we think that this approach is pretty easy to use and again, uses public data. So it's very accessible for other agencies beyond Georgia or beyond the childcare context if they want to do something similar. And I think the big takeaway here is that when we look across the maps of the different populations, they really differ in where they're concentrated. So when we're trying to reach people or design services to reach different types of people, we shouldn't assume that they're all in the same place because they fall under this broader eligibility umbrella, but we should really consider how each population differs. And if you want to learn more, you can see some examples of our findings on the report at the left. And then you can also learn how to do something similar in your community with some step-by-step instructions and links to public data sources on the right. And I will put these links in the chat as well. So thank you so much.
Melanie, you're muted.
Thank you. It was bound to happen. Thank you, Ellie, so much for that really insightful information. I know childcare is a big issue right now, certainly in Oklahoma and across the nation. Next, we will hear from Rimsha Khan. Rimsha, please unmute and turn on your webcam. Thanks.
Yes. Hello, good afternoon, everyone. My name is Rimsha, and I work at Citizens Committee for Children. We are a New York-based nonprofit focused on child advocacy, working towards the mission of having every child healthy, housed, educated, and safe. And today I'll be talking about an analysis related to childcare costs for New York families, especially those with children ages 0 through 12. And that will cover full daycare for infants and toddlers, preschoolers who are kids ages 3 to 5, as well as out of school care for school-age children. And in this analysis, I use two different measures. One is affordability and one is cost burden, which I'll talk about more in detail. And I use these measures to show that childcare is a significant financial strain for the majority of New York families. And I'm sure that that is also a trend that's echoed across the country as well. So to start off, I used two different data sets. The first was data on childcare costs, which came from the 2022 Childcare Market Rate Survey report from the New York State Office of Children and Families, which surveyed childcare providers. And the data from this survey is used to reimburse providers as required by our state law every 2 years. And then I used the Census Bureau's 2021 American Community Survey 5-year estimates, which provided the demographic data, such as the age of the children, the household structure, whether it was a single parent household or a 2-parent household, median incomes, and so on. And this really helps contextualize the data on childcare costs. So in terms of definitions for these measures, affordability is looking at the share of families with children who pay less than 7% of their annual income on the estimated cost of childcare. And this threshold for childcare affordability is based on the federal standard by the Department of Health and Human Services. And secondly, cost burden is the share of household income that paying childcare costs would consume for a family. And in this case, I'm looking at the cost of childcare for one child as a percentage of a family's median income if they have at least one child under the age of 12. And I do want to note that for preschool childcare cost estimates, those refer to full daycare options for families should their child not receive publicly funded early care education. So in New York City, we do have universal pre-K as well as 3K, although there are barriers to access. And then for school-age children, those cost estimates refer to any before school or after school care, as well as care during school vacation times. So as I mentioned, these estimates come from the market rate survey, and they're broken out by these age cohorts and setting. Data is reported in the market rate survey by county clusters, and these are estimates derived from the New York City county cluster. We have 5 counties in total, the 5 boroughs. So in this chart, you see infants and toddlers, pre-K, school-age children split by home-based care and center-based care. Center-based care is as it sounds, and home-based care covers family child care, which is still regulated, but the program is taking place in a home-based setting. We can see in general that infants and toddlers have the most expensive care. And of course, that makes sense because the younger the child is, the more care is required. And I was also recently looking at the updated estimates for 2024, and the annual costs now for children 0 through 2 is now just over $24,000. So just something to keep in mind moving forward. So moving into the analysis, the major finding when it came to affordability was that across the board in New York City, more than 80% of families cannot afford care out of pocket for a young child under 5. And this chart is showing a breakdown between all families in general, so that includes all household types, and comparing that to single parent households. And then, of course, the subcategories of age groups and their rates of affordability. And we can see that the rate of affordability is very low for single parents, of course, mainly because they're typically surviving on one income. So the affordability rate will understandably be lower. And for young children, it's only 3 to 5% in single parent families. And as far as school children goes, that rate is still pretty low and not much better. Only 8 to 10% are able to afford out of school care for elementary age children. So while we have this statistic of 80% of families that can't afford childcare, there are differences and disparities across different neighborhoods, especially in a diverse city like New York. And this is where the ACS data is very helpful when we're able to use census geographies. So I use the public use microdata area, or PUMA areas for short, and I use them to convert to New York City community districts, which are 59 in total, using population ratios. And from that, I'm able to derive these neighborhoods. So as an example, this chart is showing the share of families in each neighborhood who can afford care for infants and toddlers. And you can see the disparity between the richest neighborhoods by income compared to neighborhoods with a prevalence of low-income households. So for instance, median incomes in Greenwich Village and Lower Manhattan, these median incomes are around $445,000 for these families. And 70% of these families can afford childcare, compared to neighborhoods like Mott Haven and University Heights, which are located in the Bronx. And there are basically no families in these neighborhoods who can afford childcare out of pocket. You'll see 0% and 0.4% in Mott Haven. So there is a huge disparity. So to put this into perspective, median incomes for families with children in 2022 was just over $77,000. But in order for a family to afford childcare for a baby under 2 without any financial assistance or subsidy or benefit, the family would need no less than $232,000 in household income in order for that care to be considered affordable based on the 7% or less definition. And speaking of incomes, I'll move into talking about another way to measure financial strain on families, and that is childcare cost burden. And as a reminder, cost burden is the share of household income that childcare costs would consume. And this chart is showing a breakdown by household type and age group. And reading from the bottom up, specifically looking at infants and toddlers, we can see in the dark blue when it comes to married couple, or those families also include 2-parent families, they face an 18% cost burden for infants and toddlers, 13% for pre-K, and 12% for out-of-school care for school-age children. And single parents in the light blue category show the highest cost burden of their income that would get taken up by childcare without any assistance. Between 26 to 41% of single parent household income would go to care of the child, depending on the age. Now, to put this into context, here is an example of a 2-parent family with 2 children. And this visualization tracks their hypothetical costs across 6 years. So in year 1, the family has 1 infant, and the childcare cost is just over $16,000. The same applies in year 2. In year 3, they have baby number 2. Congrats to the family, but that also means that costs go up. And for the older child, it's around $14,300 and $16,000 for the infant. In year 4, ideally, child number 1 is in pre-K, so they only need out-of-school care, which is nearly $11,000, and full daycare for the second child, who is now a toddler. The next year, it would be, in year 5, it would be 1 school-age child and a 3-year-old in full daycare. And lastly, in year 6, both are in school, including a preschooler who needs out-of-school care, and the family would also have out-of-school care costs for the school-age child. And in total, that's over $136,000 over the course of 6 years for 2 children based on 2022. And of course, costs are rising. And in this scenario, I'm assuming the family uses the less expensive version of care, which is home-based childcare settings, which have typically lower costs. So there's some key takeaways or findings that I want to leave us with. One, as I stated earlier, more than 80% of families cannot afford care for a child under 5. A family with one child under the age of 5 might spend 14 to 41% of their income on childcare alone if they don't have assistance. And when it comes to school-age children, only 21% of families can afford out-of-school care for a school-age child. And with that, I'll end. Thank you so much. I'm happy to share the research brief that also goes into this data in detail.
Thank you so much, Rimsha, for that really important information based on your research. We appreciate that. Next, we will hear from Jill Walsh.
Thank you. I'm just going to share my screen. Okay. So thank you all for attending this session, and thank you, Rimsha. My presentation covers a lot of the same topics, and so although it's depressing that this is like such a cross-boundary issue, it is nice to see all the data coming out related to this topic. So my name is Jill. I'm a senior GIS and data analyst at CT Data Collaborative, and I worked on this with my colleague Cynthia, who is our director of research. And we use PUMS data to explore the affordability of market rate childcare for Connecticut families. A little about us at CT Data. We're a nonprofit, and our mission is to connect people and data to promote informed decision-making and to advance equity in Connecticut. We are the Census Bureau State Data Center for Connecticut, and we're also part of NNIP as the Hartford, Connecticut partner. So we, along with NNIP's other partners across the country, support local priorities by connecting communities with the data they need and the help they need to use that data. So a quick overview of what I'll talk about. I'll give some background on the project, go through the data sources that we used in our methodology, and then we'll talk about findings and implications. So this project for us came out of a survey that was going on at the same time. So the Rapid Survey 1 was conducted by the Connecticut Project, who funded this research, and Stanford's Rapid Survey Project. And they collaborated with 17 community-based organizations to deliver the survey to families across the state. And the Rapid Survey 1 focused on childcare access and affordability. I did oversample low-income families, so we conducted this analysis with public data to provide a more comprehensive look at childcare affordability for all families in Connecticut. So our overall research question was, what percentage of household income would families need to spend to enroll all of their young children in market rate center-based childcare? So as Rimsha was explaining, there's a guideline of 7%. It's kind of the amount that you would expect a family to pay for childcare. The Department of Health and Human Services uses this, and it came from a survey. It was the median amount that families reported paying for childcare through a national survey. So you expect about 50% of families to pay more than 7%, but you also expect 50% of families to pay less than 7%. And that's kind of the reasonable amount to spend. I'm going to refer to over 7% as unaffordable and less than 7% as affordable, but obviously, like, some families could afford to spend more than 7%, and some families can't afford to spend 7%. So it's just a guideline. And we focused on center-based care because it does tend to be the more expensive type of childcare. And in Connecticut, at least, there are a lot of center-based care seats. So we were working with the presumption that if center-based care is the type of care that a family wanted to use, they should be able to afford center-based childcare. Our data sources were the Connecticut Office of Early Childhood's Market Rate Survey and the 2023 ACS PUMS one-year estimates. And we found that 87% of families across Connecticut with young children would need to spend more than 7% of their income on childcare. And this majority rang true for almost all of the subgroups that we looked at, which I'll get into in a bit. So a little more about the data we used. The OEC Childcare Market Rate Report reports out weekly market rates for center-based childcare. These are based on a survey that was done, I think, at the end of 2023, like statewide. And then they also report regional rates. So I think there are 5 regions in Connecticut that rates were reported out for, and there was some significant variation between those regions. And the rates are reported out for infants and toddlers, which are 0 to 2 years old, and preschool age children who are 3 to 5 years old. From PUMS, we got the number and age of young children per household, and then the PUMA of residence and household income. And we also looked at data by race and ethnicity of the householder and by the employment status of the parents. So the way we did it was we estimated the total cost of childcare for each family in the PUMS file based on the weekly market rate for the region that they live in and the number and age of their children. And again, we use the center-based childcare. So this is like completely hypothetical that they would be paying this much. A lot of families choose not to enroll their kids full-time in childcare or to not enroll every kid full-time in childcare to reduce those costs, and there are some subsidies available. One issue we ran into is that PUMAs do not nest within the regional rates that were reported, and we were basing this off PUMA level data. So we created weighted averages for each PUMA to create their like market rate for childcare. So if a PUMA had 6 towns in it and 3 towns were in region 1 and 3 towns were in region 2, we just averaged the market rate for region 1 and region 2 and applied that to the family's cost. So with back to the PUMS data, we divided each family's annual cost of childcare by their household income. And that gave us the percentage they're paying for childcare. And we looked at this by a few different demographic variables. So here's an example of how we calculated this. Taking a family in Hartford, and this is like real PUMS data. There is a family with 2 children, ages 1 and 4. And from the OEC report, we know the cost of childcare for children of those ages in Hartford, and Hartford is its own PUMA, and it's totally within the North Central region of the report. So we just use the prices as is. And we added that together to get the family's cost per week, which was $655, and then multiplied by 52, which is $34,000 a year. Their income was about $62,000. And so the cost, so they would end up spending 55% of their annual income on market rate childcare if they were to enroll all of their children in full-time center-based care. So we do have some limitations to this methodology. One, as I've been saying, we only considered center-based childcare, but I will say that through the rapid survey, we learned that 78% of respondents would ideally like to enroll their children in center-based care versus another type of care. So it does seem to be the more like sought after option. And we did not consider sliding scale fees or subsidized childcare rates, which are available, but there are definitely barriers to access. So we wanted to just go with, if you're paying market rate, what percent of your income would you have to spend? We did not calculate margins of error, and race and ethnicity data is only of the householder. It's not necessarily of the rest of the household. So we found that 87% of families in Connecticut would need to spend more than 7% of their household income to pay the market rate for full-time, year-round care in a child care center for all of their children. This is super high. You would expect it, based on the national guideline, to be around 50%, spending more than 7% of their income. The next few slides have a similar chart set up to this. So the blue line here is the percentage of families spending more than 7% of their income on childcare if their children were enrolled in full-time care. Green is families spending 7% or less. And then we also calculated the median percentage of income needed to afford childcare. So for example, Asian non-Hispanic families in Connecticut would need to spend a median of 14% of their income on childcare. And again, ideally, these numbers would be around 7. So it starts off at almost double. And then for Black, non-Hispanic, and Hispanic or Latino families statewide, almost 100% of families would need to spend more than 7% of their income on childcare. And the medians are 25% for Black, non-Hispanic families and 30% for Hispanic or Latino families. And then looking by income, so this is state median income. And this was really important for us to look at because the eligibility requirements for childcare subsidies are tied to state median income. And I'll talk a little bit about that at the end. But it's not until you get above the state median income that some families can afford to spend less than 7% or less of their income on childcare. So this is obviously a huge affordability problem. And for some context, for a family of 3, the SMI, 100% of the SMI is about $112,000, and 200% of the SMI is about $224,000. Then we looked at the same breakdown by the employment status of parents. So we tried to look at full employment of the family. So if it's a dual parent household, this is the number for households with 2 parents in the labor force. And for a single parent household, 1 parent in the labor force would be full employment. So for 2 parent households with both parents in the labor force, still 79% of families would have to spend more than 7% of their income on childcare costs. And then for single parent households with full employment, 1 parent working, almost all families would have to spend more than 7% of their income. Then we broke this out by the number and age of children in each family. So as we've mentioned, preschool care is a little bit cheaper than care for infants and toddlers. So a slightly higher proportion of families could afford to spend 7% or less of their income on childcare, but it was still 80% would have to spend more than 7%. And then it just goes up from there. For families with 2 children or just 1 infant, 1 child who's an infant or toddler, almost 9 out of 10 families would have to spend more than 7% of their income on care. We did not include some combinations of number and age of kids due to small sample sizes, but anyone with 3 kids, no one was spending 7% or less on market rate care for all their kids. And of course, a lot of places have sibling discounts and things like that, which we did not incorporate into this analysis. But the median percent of income that families with 3 kids range from 47 to 69%, which is extremely high. And then we broke this out by Puma. So in the southwest corner of the state, you see that lighter colored Puma. Still over half of families would have to pay more than 7% of their income. 54% of families would, and that's one of the wealthiest areas in Connecticut. And then I do want to call out Bridgeport and Waterbury, they are their own Pumas. So we have data specifically for those cities. And in both of them, 100% of families would need to spend more than 7% of their income on childcare. Hartford was 97%, so almost 100. And this is not just an urban problem in Connecticut. So northeastern Connecticut is more of a rural area, and 95% of families would have to spend more than 7% of income on childcare. So it's definitely a widespread issue throughout the state. And so we have many implications of this. It's well known that childcare is extremely expensive and prohibitively expensive for a lot of families. But showing this with quantitative data is super important for informing policy and arming advocates with the numbers that they need to back up their claims. And in 2025, so this year, the Care for Kids, which is the main major childcare subsidy in Connecticut, guidelines were revised a little bit. So family fees would be capped at 7% of income if your income is up to 60% of the SMI. So as we saw a few slides back, many families making more than 60% of the SMI still cannot afford to pay full price for childcare and would be left out of this program. And also, not all childcare providers accept Care for Kids subsidies. We found through the rapid survey that only 34% of income eligible families actually use the Care for Kids subsidy. So that's 2 out of 3 families were not using them. So there's a lot of work that needs to be done to make these programs more accessible for families and more useful. And we hope that this data can inform that work. So that is it. My email is here, and I will put these links in the chat too. Thank you.
Thank you, Jill. Another great presentation showing the impact of affordability or unaffordability of childcare across the nation. So lastly, well, before we get to Leah, let me just remind all of you to put questions for all of our presenters in the Q&A, and we will get to those after Leah's presentation. So joining us now for her presentation is Leah Clark.
Great, thank you. Today I'm presenting on pandemic era public school disenrollment across the income distribution. I'm using confidential microdata for the analyses in this presentation, though I'll note that some of the ACS focused analysis could also be done using PUMS data. So public school enrollment in Oregon, like every state in the US, declined during the COVID-19 pandemic. I'm sure we all remember that public schools went predominantly virtual from March 2020 through much of the 2020 to 2021 academic year. And I'll refer to that as academic year 2021 going forward for brevity. In Oregon, in-person instruction resumed in April 2021 statewide, and the 2022 academic year was the first full year of return to in-person instruction. During this time period, public K-12 enrollment dropped by approximately 5% or 30,000 students. And I'm drawing these statistics from a report by the Oregon Department of Education, who are also a data provider for the analyses I'll show you shortly. In Oregon, this initial 2021 drop was followed by a second drop in 2022. And this was true of some neighboring states and not true of others. Some states showed a stronger recovery in 2022. And in this ODE report, they estimate that more than 60% of the enrollment drop is explained by increases in homeschooling. And they also find that enrollment declines were concentrated among white students. We're focusing on a different demographic aspect here, which is how public school enrollment changed across the income distribution. And we document public school enrollment patterns by family income from 2017 through 2022. And we're going to conduct parallel analyses of administrative record and ACS samples. And I'll get into some more details on why conducting these analyses in parallel provides some helpful insights, we think. We do investigate variation across grades and cohorts, and there's actually a lot of nuance that I do not have time to unpack in the next few minutes. Instead, I'm going to take some time to answer kind of a side question, but one I think might be of interest to this audience, which is when we look at, because for this project, we can merge K-12 administrative enrollment data on the individual level with individual level ACS responses. And that's a really unique data linkage to be able to do. We can actually look at, based on how families say their children are enrolled in school, whether it's public or private or homeschooling, on the ACS, whether or not that's consistent with what we see in the administrative records. So I'll touch upon that as well. So for this parallel analysis, I have two samples. The first is what I'll refer to as the ADREC sample. So we define the population in this sample as all school-age children who were claimed on tax returns filed in the state of Oregon. And then we're able to link these kids to K-12 administrative data from the Oregon Department of Education to observe whether or not they're enrolled in public school, excuse me, in a given year. We measure adjusted gross income, which we inflation adjust to 2019. And we have approximately 600,000 observations a year. This is essentially population level data. In terms of methodology, we use PICS to link across data sources. I'm not going to have time to get into that, but this is the enterprise approach that Census uses to link across our various microdata holdings. The estimates that I'm showing you will actually be regression model-based estimates. And again, without taking time to go into the detail, the goal here is to provide fine-grained statistics without creating any disclosure risk. So we use this model-based approach to do that. Happy to talk more about that in Q&A or offline. For the ACS sample, it does have the advantage of reaching through academic year 2023. Our population is school-age child respondents to the ACS in Oregon. And the ACS enrollment question asks whether a child is enrolled in public school, in private or homeschooling, or not enrolled. We have approximately 7,500 observations a year, and we use sample weights. And typically I'll be talking, or the statistics I'll be showing you are survey means by high, middle, and low income groupings. Okay, so why a parallel analysis? What are we worried the ADREC approach might miss? It obviously has a sample size advantage here. So the gray box represents the population we'd like to capture, which is all school-age children. But our administrative records approach actually gets us two large subsets of this population, those who are enrolled in public school and those who are claimed on tax returns. And for kids who are not enrolled and not claimed on tax returns, we don't observe them at all in this administrative records only approach. And we can't even kind of know how many of those kids there are. For kids who are enrolled in public school, we can see how many we don't observe tax-derived income for, but we can't say anything about their income. And so we're kind of stuck focusing on this red square, kids who are claimed on tax returns, for the bulk of our analysis. On top of that, the pandemic created changes in the tax filing population because policies like stimulus checks and the expanded child tax credit brought in more families who weren't previously filing, we think especially on the very low end of the income distribution. And so the main advantage of bringing in ACS data here is that we've shown in other work that using just the tax return data to define the school age population is going to disproportionately miss disadvantaged families, low-income families. And so we think ACS can offer a helpful comparison point there. Okay, so for because of this concern about the more families filing taxes during pandemic years than prior, we're going to focus on dollar income ranges instead of, quartiles or percentiles or the median like you might typically see in analyses like these. And so at left, I show the baseline public school enrollment by bins of income in 2019 in the ADREC sample. And then at right, public school enrollment rates in the ACS sample. Now, the good news here is that when we look at the middle of the income distribution, and the middle category you can think of as capturing roughly the middle half of families by income, the two data sources agree pretty well. So around 85% of middle income families in the ADREC sample are enrolled in public school, and around 87% in the ACS sample. And the rates are also quite similar for high income families. It's a little deceptive because you see these big bins, but those are actually relatively small numbers of students. And so generally speaking, even high income kids are largely enrolled in public school. But where we have a discrepancy with the ACS numbers is among low income families. And so in the ADREC approach, we get probably 82 to 83, 84% of kids enrolling in public school, while in the ACS, low-income families, 91% enroll in public school. I don't have great insight into that discrepancy at this point. So the levels are a little different, but how do the trends compare? So at left, I'm showing annual public school enrollment rates by academic year in the administrative record sample. And it might look like I'm choosing some arbitrary income values here, but these are meant to kind of represent the bins that I show you for the ACS at right. And what we see in the ADREC sample is the clear enrollment drop for families of all income levels in the 2021 school year, and that drop is sustained or even becomes larger for very low income families. In the ACS data, which continues to 2023, we also see these drops, and then we actually start to see some evidence of rebound. So we're looking forward to getting additional years of data for both of these samples so we can really make sense of whether the rebound is really happening and how it's happening across the income distribution. I will note that the timing of the enrollment shocks are different across these data sources, and that's because our administrative records are really telling us whether a child was enrolled at any point during the relevant academic year, while ACS asks about school enrollment in the last 3 months. And so it makes sense that in the 2020 academic year, ACS data would start showing the enrollment drop with COVID, because families surveyed in April, May, June will be dealing with the pandemic schooling situation. And like I noted, I won't have time to get into a lot of details, but with the ADREC sample, where we have enough data to decompose by grade and cohort, we find that the sustained decline for low-income families heading into 2022 is happening in higher grades. And this is a huge point of concern because it points to the possibility that high school dropout increased really substantially for this population. And that's something we're really hoping to make more sense of as we deepen this analysis. The only place we're seeing signs of rebound in the ADREC sample in 2022 is in kindergarten enrollment, but even there, we're still well below pre-pandemic levels, especially at higher incomes. The ACS gives families the ability to state affirmatively that they're using private or homeschooling. And that reveals an interesting pattern where we see that high income families, their private homeschooling use increased during the pandemic and it's been sustained. While for low income families, we're seeing a drop off where the surge in private and homeschooling usage seems to be coming back down. And this is consistent with another census data source, which is the Household Pulse Survey, which is one of the rare sources of information about homeschooling that asks about homeschooling on its own. And they find that lower income families were more likely to use homeschooling relative to private school during the pandemic, but also that Oregon in particular, we're seeing a drop in 2023, 2024 in homeschool utilization. So this is consistent with that. Okay, finally, I'll wrap up by noting this kind of data quality question that we can dig into using, because we can link this K-12 enrollment data to ACS responses. And so what this graph shows is that for each ACS enrollment response, what share of individuals, what share of children who, for example, are enrolled in public school, do we also see those children appear in the public school administrative records? And we get high agreement for families who say that the child is in public school. So 90% pretty consistently also appear in the administrative records. For the not enrolled group, which is quite small, right? Because this is these are compulsory schooling ages largely. So this is just 2 or 3% of kids. And we're actually seeing that somewhere between 1/2 and 2/3 of those kids are actually showing up in the public school enrollment data, which is probably good news. And then for the private and homeschool responses, we see that between maybe 1/4 and then rising to 1/3 during the pandemic of children who are reported to be enrolled in private or homeschool also show up in the public school enrollment data. And this could reflect just kind of this timing mismatch of like you started the year in public school, but then you ended it in private school or in homeschool, which was obviously a common scenario during the pandemic. But another factor that I'm interested in digging into more in future analyses is the rise of publicly funded virtual schools. So in Oregon, there's long been a virtual charter school sector, but the Department of Education also started offering, traditional publicly administered, publicly funded virtual schooling. And I think parents whose kids are in virtual school could kind of justifiably report either being in public school or homeschooling. So I think I've already spoken about the things we're looking forward to digging into next. And so I will go ahead and wrap up. Thank you.
Thank you, Leah. Thank you all of the presenters. Really informative and insightful research. We now want to highlight some questions that some of you have asked. I think some of them have also, so sorry. Some of you have already, and some of the presenters have answered those online in the Q&A. So let's start with a question from Elise Bowie. I'm not sure I'm saying that right, but the question is for Ellie. She asks if you have any thoughts on how to adapt your analyses to a smaller geography level. Some states have large-sized counties.
Yeah, I think this is a great question. And the unsatisfying answer is that it really depends on your state context and what is kind of meaningful to how families or people experience in terms of differences in policy at different geographic levels, as well as what data are available. If you're interested in more like state reported data, I would see what the levels are that the state reports. If you're more interested in like income and poverty measures, and so you're going to be using ACS data as your primary data source, they have a lot more options for your summary level data, so you can adapt whatever geographic level is really to suit the context of your state, because ACS has different options. But yeah, it depends on like the breadth of your analyses, and also if you're able to access restricted use data, because sometimes those are going to be at smaller geographic levels as well. And for more information, you can see that the how-to report, we have additional considerations on other things you might want to think about as you're considering your geographic level.
Great. Thanks, Ellie. I don't see any other unanswered questions in the Q&A, so please keep adding those if you have them. In the meantime, I have a couple of questions. So this is really to all of you, and this is all such important research to our community's well-beings. What do you hope will happen as a result of the work you've presented about today?
I can start answering that one. So I'm definitely hoping that policies in Connecticut have been pretty responsive to public conversation, and I'm hoping that having this quantitative data can help move that forward more. And I think it's everyone knows how unaffordable childcare is, but it's a little surprising to see in the data how widespread that is, and it's across the state, across all groups that we looked at. So there's definitely room for more research into other subgroups or looking at other data points that's available in PUMS or other sources. And I think the more it's talked about, hopefully more policies can be adjusted, because there are a lot of things in place to reduce the cost of childcare. But they're just not totally working. So I think it's not we're starting from zero and getting policies in place. It's more just continuously improving them and making them more responsive to as life gets more expensive lately.
Anybody else have thoughts about that? What do you hope will be the impact of your research? What would you like to come from that?
Well, I'll speak from strictly a data nerd perspective, which is that we often lack good measures of income, let alone a broad range of socioeconomic circumstances for children. And they're so critically important for understanding school access, certainly, which is the theme here today, but so many other issues. And I think both in seeing folks leverage the ACS data, which lets you get more fine-grained on that, but also in thinking about what states and municipalities can do with the data that they do actually have access to. There's a lot of restrictions over using IRS data like I did today, but there's a lot more resources for using more enriched measures of family circumstances. And I think that belongs in the conversation just as much as the many factors we've been more easily able to track over time, like race and sex disparities.
Thank you. Ellie or Rimsha, do you have additional thoughts?
I can jump in. I really hope that other agencies kind of look to take similar approaches when they're looking at their populations. Like we mentioned, that there's a lot of variability in where people are and what their experiences are, even if we kind of categorize them in similar ways. And so looking at increasing equitable access, or I know a lot of states are facing some budget deficits right now and looking to cut programs. So as agencies are making those decisions, I think this approach is a really good way of seeing if certain areas are going to be adversely affected and what kind of those impacts would be.
Thank you. Rimsha, anything to add?
Yeah, sure. So I'd like to add at CCC, we're always advocating for greater access to early care and education. So we definitely like to see policies that support access. For instance, one of our policy priorities in the last legislative state budget cycle was raising the eligibility in terms of guaranteeing childcare assistance through a program called CCAP for eligible low-income New Yorkers. And we were able to secure $350 million, although that was a shortfall compared to the goal of $500 million for childcare assistance. So it's constantly sort of a fight to move towards universal access, but of course, starting with the populations who are most in need of childcare.
Great. We do have another question from the audience. Katie Lakey asks, are there any reports or published materials that go along with Leah's presentation? And I will point out too, I think several of you presenters have added some links. I think I saw some links somewhere. Now I'm not seeing them. In the chat. Yes. Yeah.
Yeah, I'm not sure if you're able to download the slides through this platform, but please feel free to email me and I'd be happy to provide a copy of the slides. The statistics are hot off the presses in terms of our disclosure process at Census. I just was able to publicly release them. So we are working on a more comprehensive brief and further statistics on this topic, but nothing more to share yet.
Great. Thank you for that, Leah. Yeah, and there is information that the presenters have provided in the public chat if you all would like to go there and access any of those. Cheryl Paham asks, what is the impact of childcare affordability you observed in your analysis on employment levels? That's not addressed to anyone in particular, so anyone is welcome to answer that.
We didn't look at it by like comparing to families without young children, but that would be super interesting to look at for further research. And I saw a similar question about looking at this by profession and like occupation with occupation data. That would be super interesting too. I love these ideas, but I don't know of anything that's out there now. I know like anecdotally, a lot of people are delaying going back to work or working part-time to lower their childcare costs. I know like some people are trying to do reduced schedules, so working like 9 hours, 4 days a week, or 10 hours, 4 days a week to have that one day without paying for childcare at least. So people are definitely coming up with creative solutions, but I haven't seen any like quantitative analysis on that.
Great. Thanks for that, Jill. Eileen O'Brien says, Census has occupation data. Has any analysis been done demonstrating what professions by household types carry the biggest childcare cost burden? How deep and broad the burden is? And you addressed that a little bit, Jill. Does anybody else want to address that?
I'll just jump in with a point that I think is relevant to the earlier question as well. A colleague of mine who was previously at CCC did an analysis using the household pulse survey data that was rolled out during the pandemic era, and it was temporary. And when they analyzed the data for the New York metro area, one of the major findings that we saw were that women were 7 times more likely to drop out of the workforce than men because of childcare. So I thought that would be an interesting, although that's not really derived from the ACS. That was an interesting finding. And we haven't done analysis by occupation, but it's certainly doable. And another thing to remember is also like on CCC's front, we also think about the childcare worker force and who are also severely underpaid. So even the workers within the industry. So that's also something to keep in mind as well.
Great point. Another question from the audience, Leanna Balafet. And I apologize if I'm not saying your name correctly, says, I love how the Pumas allow for breaking up larger urban areas into smaller chunks. Any tips for dealing with lower population areas where the Puma is huge? are you using state collected data to get county level estimates, doing some sort of combination with 2020 census tracts? Anyone may answer. Anyone have thoughts on that? Or you want to think about it a minute? We have a few more minutes for questions, folks, if anybody wants to enter. Others?
I can say something about it. So in Connecticut, we do have some really, really large pumas that are like the same size as counties. But we also luckily get county subdivision data, which is like perfectly aligned with our towns. So if we can do town level analysis, we try to start there, but obviously we can't use PUMS data for that. So it's kind of just a continuous conversation of finding a balance between like the level of detail in the data versus like what crosstabs you really need. And if there's any way to like get around using PUMS data and using like ACS data that's similar enough, but might not be quite as specific, so that you can provide towns with like data for themselves, because they need data too. And they all like run independently. So we don't use PUMS data a ton, but for towns where like the town is the PUMS, it's like very convenient, and we use that a lot.
Very good. Thank you. I have another question. I think many of you may have heard of, maybe familiar with ALICE, the concept of ALICE, Asset Limited Income Constrained Employed, which is a robust data set developed by the United Way of Northern New Jersey. I'm just curious if some of you are familiar with that, or if you have tried using that. I see some smiley heart responses from the audience. Great. If any of you presenters have looked at that data or used that data to supplement your research.
I'll jump in. So I did recently connect with someone from United Way a couple of months ago. I believe it was Claire Reed. And she was actually looking at our New York State index for child and family well-being that we'd put together, and we discussed sort of uplifting each other's work, and it conveniently works out that I think there are some ALICE reports that are published on the year that we don't publish our state index. So it kind of, that's like a perfect way to almost like complement or reference each other's work. So it was great learning about the tool, and it's really valuable. I believe it's like a calculator that you can use to figure out what is like the basic living wage for a family. Versus the federal poverty measure, which is also useful because it's used for eligibility programs, but it doesn't necessarily tell us the full story of how families survive.
Absolutely. Yeah, that's exactly what it is. And the data are available for all of your states, I know, and it's publicly available to anybody. But it's called ALICE, Asset Limited Income Constrained Employed. If you're not familiar with it and you're interested in looking, let's see. I think we have another question here, and we just have a couple of minutes left. But let's see if we can get this one in. Leanna responded, thanks. I'm working in Washington State, and we have several pumas that cover 3 to 5 counties with pretty different demographic characteristics that are then diluted. Makes the ACS difficult for my use when trying to understand needs in the eastern part of the state. Maybe in 2 years, I'll have a great presentation about how I solved it. Yes. We hope that we see you here presenting, Leanna. Great. Ben Taft added in the chat 2 related measures of sustainability. Oh, Living Wage MIT from the MIT. Yes, that's a great resource that I've used a lot too, Ben, for calculating living wage at the county level. And and the MSA level. Thank you for sharing that. Diana, I am not seeing any other questions. Am I missing any?
I don't think so. And we're just about at time. We're now at time.
Okay, great. Let's wrap up then. Thank you all, Jill, Remsha, Leah, and Ellie, for your tremendous presentations. We appreciate your research and sharing them with us today. Thank you, attendees, for joining this session. We now have a 10-minute break for the conference, and then that will be followed by the next breakout session beginning at 1:30 Central Time. So hope you're planning to stay for the whole day, but remember, recordings are available if you're not able to, and you can check into other breakout sessions you weren't able to join today. So thank you all again.
Thank you.
Take care.